Okay, committee will come to order. First order of business is just approval of minutes. Is there any questions on the minutes? If not, I'd take a motion. Moved by Senator Allen. Do I have a second? Second by Senator Sykes. All in favor say aye. Aye. Opposed, no. Minutes are adopted. First thing on our real agenda, number 2 there, possible approval of the Propylon contract. I have 2 people we may have speak on that. Tom Day first and then Allen. Is it just, okay, we'll go straight to Allen. Allen, you're up.
Thank you, Mr. Chairman. Mr. Chairman, you requested I provide recommendations to you on the Information Services and Systems RFP and the Propylon contract. I provided a memo to you, and I believe that memo is in the members' packets. On the first page of the memo, with your permission, Mr. Chair, I'll review that memo now. On the first page of the memo, I provided some background information. The KLIS, the Kansas Legislative Information Systems and Services, uses the Propylon LRMS core system. This core system consists of data stores with complete document history, metadata, application programming interfaces, and user interfaces. The Kansas Legislature has a perpetual license to that core. And in order to receive maintenance updates and system updates, the legislature should continue to contract annually with Propylon for these services. The legislative applications for creating, updating, processing, and publishing bills, resolution statutes, and associated documents run on the Propylon core. The Kansas Legislature owns this base system software. Our staff, the Kansas Legislative Office of Information Services staff, maintains, enhances, and resolves issues with these base applications. And our staff works closely with the division, the legislative divisions as required, to enhance and maintain these applications. At times, depending on requirements of the enhancements request, our staff needs the assistance of the Propylon resources. When Propylon resources are required, we utilize a project objective document or POD process. We develop the POD process within the Propylon contracts to provide a strict definition of the projects, the cost, and the deliverables, and depending on the project and which division we work with, there are sign-offs for the divisions on those projects. So if you turn to page 2, my first recommendation is that I recommend the LCC appoint a subcommittee to review the legislative information systems. The subcommittee will determine what issues exist, required system enhancements, and develop a long-term plan for the systems. At a minimum, the subcommittee should consist of the following member: the reviser of statutes, the director of the research department, the chief clerk of the House, secretary of the Senate, and director of legislative administrative services, and the legislative chief information technology officer. The subcommittee will determine if RFP should be released as part of the plan. The subcommittee will review the information systems platform and review demonstrations of system capabilities. And the subcommittee can then make a recommendation to the LCC for consideration by the end of this calendar year 2021. My second recommendation is that we continue contracting with Propylon to provide support for the core system and to add the POD funds in the contract for additional assistance as needed. I further recommend we maintain the current contract funding of $180,000 annually for core system support and up to $400,000 annually for project funding. I recommend we continue to contract with Propylon annually as we continue to use their core system. And with that recommendation, I've listed potential project objectives that we would look at this year, this fiscal year, potentially going into the next fiscal year. But These project objectives would provide information that would be needed to help develop the long-term plan as recommended above. And this, four of the main ones are the analysis and modifications to the applications to potentially use Microsoft Word as a document editor and evaluate the benefits of that. Balloon document generation for the reviser's office. The appropriations processing system. This is a system that allows the reviser's office and legislative research to review sections of the budget bill and create and generate the budget bills. And then system security to analyze and enhance the security to be integrated with our legislative security systems. So that is my recommendations.
Questions? Representative Hawkins.
Thank you, Mr. President. So, refresh my memory. I was thinking that in previous meetings that there was a directive given to get an RFP done, to go through the process and get it done so we could move forward. So since that hasn't even started, and now you're recommending a subcommittee, we've lost how many months that we could have been used to get this RFP done? Why is that not done?
We developed an RFP and provided that at the December meeting last year for the LCC. And if I recall correctly, there were some requested updates to that. And I think the LCC was going to meet again in January, but I don't think that meeting happened. And then in that meantime, we had the division directors meet, and we did update a version of that RFP to meet the needs of the division directors. So we do have a copy of that RFP, but I don't think there was ever a directive from the LCC to release that RFP.
Senator Wilburn, and then Representative Finch.
Thank you, Mr. President. First of all, I have a question on these recommendations. Mr. Chairman, or Mr. President, do you plan to bifurcate this into two motions, recommendation 1 and recommendation 2?
At this point, I didn't even have it on the agenda, recommendation 1 for the subcommittee. We're really talking about the contract.
Thank you very much.
Representative Finch.
Thank you, Mr. Chairman. A brief bit of history, perhaps, for the committee. I know some of the members have not been here since the beginning of this. This started back in well before December of 19, when former Senate President Wagle had raised some issues with the Propylon contract and some additions and enhancements that she would have liked to have seen as part of that. And in December of 19, we both talked about issues of transparency. You'll remember that at the time there was a big push to get bill sponsors on bills to provide more information to the public about legislation going through the process, what happens if there's a gut and go, what content is inserted, what happened to the old bill. How can we make the process more transparent for a Kansan who might be trying to follow along online with what's going on in the legislature? And we talked even at that point about modernizing the system. So at that time, we approved the Propylon contract for a 6-month period and said, we'll bring this back at Mr. Day's suggestion, we'll bring this back in 6 months and try to move this forward. And that happened in July of 2020. And at that time, according to the minutes, there was a directive to staff to work with Propylon on needed updates to the current system and to direct staff to prepare an RFP as discussed by the end of calendar year 2020. That motion carried. That is a directive to staff to prepare the RFP. The RFP was prepared. It called for an almost 5-year implementation of a new system. And you'll recall that I was concerned about that timeline, Mr. Chairman, because I don't believe we should take 5 years to implement a new system. I believed it could be done in a shorter time frame, and we asked for that update. That didn't need to be presented at a meeting. That could have been presented to us at any time. The timeframes could have been adjusted, 2 years, 3 years. Something in a more manageable time frame to try to get something done, but we don't have that today. Fast forward to the end of the year, 12/30/20, and that's the meeting where Chairperson Reichman directed Mr. Weiss to provide additional information to answer questions of LCC members and make necessary changes to shorten the time frame. We didn't get that. We still don't have that. What we have are recommendations to study the issue some more, to appoint a new subcommittee, to take some more time, to run out the string, and avoid doing what it is that this body directed. I'm sorry for Propylon, who I think has done some good work and who is trying to work within our constraints of our current system, where they're dealing through a middle person instead of directly with end users sometimes. But the reality is that this system has been in place for over a decade. We have seen firsthand the problems at Department of Labor when we have dated computer systems that are not updated to handle the needs and demands of the contemporary users. And I do not want to see that happen on my watch when it comes to the software that we use to draft and pass legislation. It is the single most important function of the legislative branch of government. And the fact that we have not updated, not considered alternatives, despite the request of this committee, who is charged with handling the legislature's business when they are not in town, is, I think, shameful. It should have been done by now. We should be going out for an RFP to see what else is out in the marketplace. When this group makes a motion and gives a directive, it is not optional. It should have been done by now. And so I will go along with a 6-month extension of the maintenance side of the Propylon contract, but it seems to be the only way we get any movement around here on this concern. And I will not go any further. I will not supply additional funds. You'll recall my question last time on the additional funds. What projects are started? What projects are pending with that extra $200,000 in taxpayer funding? None was the answer. We have some proposals, but none are pending. I will not agree to a recommendation that spends another $400,000 without knowing what we're getting and what the time frame is. It is time for an RFP on the state's lawmaking software, and that should be done post-haste. Thank you, Mr. Chairman.
So that actually brings up, because some of this predates me, that added 2 questions to my list. Why wasn't there an RFP? My understanding, there was an RFP approved by this committee prior to my presence on it. Why wasn't there an RFP issued?
Mr. President, if I might add some clarification here. We did do an RFP. We did make the updates into December that were requested by the council. We put it on the draft agenda for the LCC meeting on January of 2021. It was taken off. That's all I can tell you at this point.
So, Representative Speaker Reichman.
Yeah, the RFP that came out it took 5 years, and we said before you send that out, we could shorten that time because we're not going to wait 5 years to fix this. I believe the meeting you're talking about never happened. We had a change in administration. We had a transfer from Senate President to myself to the new Senate President. So I don't believe that meeting even happened. How many meetings have we had since then?
Just since the end of session, right? I mean,
How many meetings have you chaired? I hate to put you on the spot, but more than one.
yeah, 3.
And so for us to ask for an RFP to be presented to this body, and then for the excuse to be, we didn't meet or didn't put it on the agenda, I'm not gonna stand for that. We asked for an RFP to come in front of this body. And so if you're saying that this body ignored that and didn't take it up, I'm not gonna stand for that either. We've had many meetings to talk about it. We're finally talking about it only because the extension's up. If you go back to our minutes, every 6 months we talk about this issue, and every 6 months we do the same thing. I think today's the day we do something different.
So my follow-up question then is the information that was apparently requested in December of 20 that did not come to fruition. Was there, so there were questions that were never answered? Representative Finch.
Yeah, Mr. Chairman, I think we asked for a shortened time frame. That's what the minutes reflect, that the speaker asked, get us a condensed time frame, that's still doable. We're not trying to micromanage to take away, IT's ability to use the right time frames, but just shorten the 5 years. Let's get into something, like I said, that's, 2 years, 3 years, something manageable. We've not seen that RFP.
Senator Sykes, you had a question.
Yes, Thank you. I too am new to this, but I do recall having this conversation in the Joint Committee on Information Technology. So I believe as we talked about IT projects, this was discussed. Is there any information from the minutes in that committee that could be helpful in this? I remember I asked questions about the transparency of, making sure if something got put into a bill as an amendment or in conference committee, and as you're looking at the legislation, it may not show. It looks like it's just kind of died in committee. So there were conversations in that joint committee on IT about this, but I'm wondering if there's minutes that could be helpful moving forward.
I think there was a question by Chairman Hoffman about the status of it. And I think I probably commented that it was still before the LCC.
I think given the discussion here, the maintenance contract's obviously something we need to deal with. So I think I heard from Representative Finch, what would be a motion to approve the maintenance side for 6 months. Representative Finch?
Mr. Chairman, with your leave, I'd like to make a motion that extends the maintenance contract for 6 months, directs that an RFP with a 3-year implementation schedule be sent out on or before October 15th of 2021.
Do I have a second? Seconded by Speaker Reichman. Discussion on that motion. Now, just to make clear, so there's the special project dollars in here. We're going to leave that until we see what. Matter of fact, I think what I'd like to, if you'd be amenable to adding them, I'd like to have a little bit of a report myself at the next LCC meeting about, from your perspective, kind of where we're at, maybe including the progress towards an RFP that is looking to be dated at October 15th. Majority Leader.
Thank you, Mr. President. The question was, on the motion was by October 31st, 21, is that right? That's when the RFP goes out, 15th?
Issued by October 15th, 2021.
When will that come back to us?
We'll leave that to staff discretion, but it'll be a 3-year implementation schedule instead of 5 years. The plan should be fully implementable in 3 years.
Thank you.
So I think I will schedule a meeting between now and the 15th so we can get a report and update, but I think the motion's probably in order. So further discussion on the motion? Seeing none, all those in favor say aye. Aye. Opposed, no. Motion passes. Next item on the agenda is we had a request for special committee on education. JG, do you have the update on that one?
Thank you, Mr. Chairman. Chairperson Christy Williams has sent in a request for a special committee on education. They would like to study the academic achievement of students after the increased funding from the Gannon cases. They would propose looking at 7 different topics: the funding, some longitudinal reports, some rules and regs from the department, some of the legislative priorities from the department, and priorities from their success tour, expectations for at-risk students and funding, and then the constitutional roles for the legislature, Board of Education, and local school boards. They were requesting up to 2 days.
Committee questions on that? It'd be my inclination to approve, but Senator Sykes.
I have just, is this a joint committee with Senate and House, or just
Yeah, they're requesting a special committee.
special committee? And
Be appointed by them.
Is the size of the committee?
That would be up to the discretion of the LCC.
Yeah, and we've typically been doing committees around 11. So we'll stick to that same size with this, I think. But so my inclination would be to take a motion to approve with 11 members.
And by 11, you're talking about 5 Senate and 6 House members.
Correct.
And then appointed by the
Speaker and the
Speaker
President.
in this.
So that would be the motion I would be seeking.
Yes, Mr. President, I would so make that motion.
It's moved by Senator Wilburn, second by Representative Hawkins. Pardon, what was that? 2 days, for 2 days, correct. Yeah, thank you. Further questions on that? Seeing none, all those in favor say sway. Further questions? Senator Sykes.
I have not a question. I just, our other special committees, I think, are kind of gearing to something a little different than what this is. I know just for me personally, as I'm engaging and getting ready to go back into the session, I have a lot of these conversations with these. So my concern is that maybe this is something that we should be doing just as members of this committee. And a lot of this, we will get reports because they are in statute, that they're required to give us this when we get back in January, but I will support it.
Further discussion or questions? Seeing none, all those in favor say aye. Opposed, no. Motion passes. 4 on the agenda, legislative staff to work with Spark working groups. JG.
Thank you, Mr. Chairman. The Spark Executive Committee met on September 8th, and they were looking at the structure and the process they were going to be using to be distributing the approximately $1.3 billion that's coming in from the federal coronavirus state recovery fund. The recommendation was for 8 to 10 experts to be selected by the committee and focus on 1, economic revitalization, 2, health and education, 3, connectivity, and 4, efficiency and modernization. So the proposal was for the advisory panel to be staffed by a joint effort with legislative research and the Office of the Recovery. And as you remember, President Masterson, Speaker Reichman both recommended that pending approval for legislative agencies to help staff these panels. So that's the question before you.
Thank you, JG. And as my understanding, so this would allow us to use some Spark dollars for those salary amounts inside legislative services to support that effort. So, panel, if there's no questions, I mean, I'll take questions now. If not, we'd seek a motion to just approve that authorization. I had a move to approve by Majority Leader. You want me to give it to him? All right, Majority Leader Alley, Senator Alley, and then seconded by Majority Leader Hawkins, Representative Hawkins. Discussion. Seeing none, all those in favor say aye. Opposed, no. Motion passes. Number 5, discussion. We had had this discussion prior. It was on the room shift, and the House has been very interested, us as well, in having the meditation room back. We had looked at a shift that was worked in the different spaces. I think it was, in conversations with the speaker, was not as beneficial to the House, so they didn't feel that. So I didn't want to impede on that. So it got revamped with no changes to House officing, but accomplishes the goal of the meditation room and shifting some east side rooms that better fit us as a Senate. So I wanted to have this discussion and potential approval of this room shift as it's laid out before you. So any discussion on that at this point? Representative Hawkins.
Thank you, Mr. President. This is the first time I've looked at this, but one thing jumps out at me really big, and that is staff offices for the governor on the 5th floor. Have you thought about the fact that when you have the governor's staff on the 5th floor, that's going to impede upon our control of the 5th floor? And at that point, she will start saying we got to wear masks on the 5th floor. And heck, who knows, she may want everybody vaccinated on the 5th floor.
Well, Representative, I think we've made it abundantly clear in this committee. She would have control inside the offices of 541 East, the same way she would have control inside the governor's offices and the lieutenant governor's offices. We actually made it clear, and if you'll notice, the signage got changed for us, so we appreciate that from LAS, that only applies to executive branch employees, and that the common spaces are controlled by this chamber, and it actually allows me to move some of my people down onto the 4th off my gallery, so that was the benefit for us. So
I will tell you that you better have it in writing, crossed, I's crossed, all the I's dotted, all the T's crossed, and everything, because we got sued here a while back when we had an agreement with the governor. So she has a habit of finding out what's good for her, and then she changes. So I'm not too trusting in that one.
duly noted. Further discussion? Majority Leader Alley.
If there's no further discussion, I'll make a motion that we approve this change to make sure, but make sure that the i's are dotted and t's crossed on 541E. But go ahead and approve this as presented.
So I have a motion. Is there a second? Second by Senator Sykes. Discussion? Speaker Reichman.
Thank you, Senator President. One of the things that, wasn't just our objection to taking 4 House offices and trying to put them into 3 Senate offices. It was also the displacement of the library staff. What's the plan here for library staff and where are they going and what's the cost to the state to do that?
So I know that this was anticipated at some level, the prior deal, so there was an appropriation, I believe they're in Landon, and that's all been working with the governor's office and the library, that the library staff is amenable. And actually, that actually brings up a good conversation for the future, and that is, what does the library look like long-term and how much space it consumes, and how it's laid out in the Capitol. I'm sure we'll have a future discussion about that, but we'll get subject to enjoy Hawkins' comments. I've had assurances from the governor's office that they're amenable to this shift on this side.
Well, I guess we kind of need to know the why. We understand that this conversation started because we wanted a meditation room to be used for meditation room and not for the governor's office and her staff. So we can fix that, but now we morphed into some other changes, which displaces the library staff. And what's the why that, the Senate's operated under the number of offices it's had for all these years, especially after the remodel has happened. So what's changed that the Senate now needs more office space?
So there's a couple layers to that. One is we're having an issue with some of our Senate Secretary staff and we're not ADA accessible up behind our chamber. And so we've been looking at doing some shifting around to get access there and just moving in general. And it's really not more space for us because the 541 is not significantly different than the 4th floor space. That's more of a convenience that we had been looking at. And so there was several layers of benefit on our side, and that's why we wanted to go ahead and proceed with it, not to mention the benefit of getting the meditation room back in the mix of it.
Right. So I understand the Senate clerk office's meeting space. That's just an easy swap. We have open communal space on 421 that at any time, it's reserved. When I was my first year, when I shared an office with someone, it was nice to have those meeting spaces, to have private meetings. But if they're not needed, I can see, but we can do that without displacing the library staff. So I guess my question is, again, back to the need for the Senate offices. And again, it's just a courtesy to the library. I want to make sure that this is something necessary, and also want to make sure that it doesn't cost. Because I know during the time we want to put a proviso in is about $30,000 a year to move the staff out the building. I have not heard an update on that number, so I guess we just want to make sure we understand the full need of why the Senate needs to expand, and then make sure there's not really a cost to make sure that can happen.
I mean, comments duly noted. I guess the inverse for me is if the House had determinations of space and it didn't affect me at all, that I'd probably just be amenable to it. But I understand where you're coming from, I think. But in the end, I think this benefited us and the governor's office with no objection from the library and didn't affect the House. So it seemed to make sense to have it on the agenda.
So there's no objection from the library on this?
My understanding from the governor's office that the library is amenable, yes. Further discussion? Majority Hawkins.
I got a proposal for you. I'd like to make a substitute motion, and the substitute motion would be at this time to move the governor people down to the meditation room and the meditation room up to 221 and give us time to talk through the rest of this other stuff. The one thing that probably we all get a little bit testy about when we don't get to talk about this until it comes to a meeting. We don't hear about it before the meeting, and then all of a sudden, we get this in the meeting and we have to make a decision, and quite frankly, we don't know that everybody is amenable. I would like to hear from the library staff. I would like to hear what everybody's thinking on this, and we can't do that in here except from somebody that's talked to the other parties, which we don't know who that is. Well, I think I do, but it's probably you, but nobody else has. So I would like to make the motion that we do that switch and hold off on the rest of this stuff until such time as we can talk. And we can talk within the next few days, probably. And come back with another meeting sometime here in the future, and maybe we will be amenable to this. But right now, that has been, my position always has been getting the meditation room back where it was and put the governor's staff downstairs where they moved us, so our meditation room. So I've not really been concerned about all of these other shifts. That's what I've been concerned, and that's what I want to see done. So that's I would have liked to have made that motion last meeting, but we couldn't do that, so. I'll make that motion now as a substitute motion.
The door's
Talked too
open.
long. Thank you.
Substitute motion's been made. Is there a second? Second by Representative Finch. Discussion, Senator Sykes.
So this has been a long drawn out, I think this is 3 years that we've been discussing this. Well, I haven't, I've been discussing it since January. I've actually had the conversation with the library staff, asking them, talking to them with the concerns. And honestly, if the Senate has worked with the library and the governor's office and all of this, and we have come to a consensus and everyone is happy and it's not affecting the House, I think we should move forward with the original motion and put this to bed. And I also would say that I hope that the governor's office would also use the meditation room. I don't think the speaker was trying to say that they were not allowed to in a previous comment, but I think it should be open for all.
Further question or comment on the motion? I mean, I'm not sure I understand, but I would actually like to address the underlying motion as well. And not that I want to, because I love my friends on the House, and I'll commit right now not to interfere in anything you do on the House side as you do. So, but we'll go. Any further discussion? If not, we'll cast the vote on the substitute motion. All those in favor say aye. Oh, Speaker Reichman.
Yeah, thank you, Senator President. And those words, they resonate. Again, the clarity to me, it does affect us if it costs money and if it's displacing people that work in the building. It does sound like it's not going to have a cost to the state at all. I mean, when we rent office space, it does cost us money. That's how it does affect us. But I understand what you're trying to do. I have also the same concerns that our majority leader has as far as having the governor's office is now on the 5th floor as well. It's a lot to take in. So that's all I'm going to say there.
Further discussion, Representative Finch.
I would just like to say that in the spirit of cooperation, I do want to give deference to the work the Senate has done. I'm not saying no to any of this, and my second of the motion was not a rejection of the underlying proposal. If we'd have just a little bit of time to look at the other pieces of it, I think that's all that the House is saying. We're not denying the Senate's request. We're just saying, can we, have a little time too, and can we run down this question of dollars as well and do it quickly? I mean, we can have another meeting soon and do that. So I just want to be clear, my second was not a rejection of the Senate's request or any attempt to slight the Senate and the work that you've done.
Appreciate the comments. Further discussion. Representative Hawkins.
I want to say mine is not a rejection of the Senate either, quite frankly. All it is a delay. Let's delay that piece, and we'll come back and we'll talk about that. But I would like to get my part done right now.
Wouldn't we all? Further discussion. Majority Leader Alley.
I don't have a, thank you very much, Mr. President. I don't have a problem with the delay, but the first meeting I attended, this was discussed. How long delay? Time frame 2 days, 5 days, next week? 21st of September?
Is that a question for
That's a question.
Representative Hawkins?
So I don't remember this being discussed. What was discussed was moving the meditation room back up on the second floor and the other one down. And it's never been, nothing's ever been done with that.
Clarity, we took a tour.
We did take a tour.
Yeah, of all these a while back.
The tour was taken, and I think there was some discussion of taking away the library. The question that we had at that point, or that I had at that point, was exactly the 1 year. Who else does that affect? Well, Governor, is she going to agree to this? And I think that was what was asked to go out. So I think at this point, I don't want it to go on forever. I would consider a delay, but I think a week is enough time.
I think we ought to call the question.
All right, question is called. All those in favor say aye. Aye. Opposed, no. No. Motion fails. Back on the substitute motion. Further discussion? Seeing none, all those in favor say aye. Aye. Opposed, no. No. Motion passes. On to 6.
Hold on a second. I think.
All right, Speaker Reichman.
I think we need to do a roll call count on the last vote.
Very well. Does anybody wish to have their votes recorded? Or you want a roll call on who we have call the roll? Tom, call the roll. Actually, is Tom present? Representative Sawyer, are you present online?
I'm online. Can you hear me? I'm on
We
the line.
can. If you've been keeping up, we're about to take a roll call vote on the positioning of rooms inside the Capitol. Are you prepared to cast a vote?
Yeah, is this the substitute motion or the original motion?
This is the original motion on what's in your packet.
Okay. All right. Yes, I'm prepared to vote. I vote yes. Is that what you're asking me? I vote
Okay.
yes. Yeah.
I withdraw the request.
Very good. Motion passes. On to 6. So we're now on 6. This one I'll bring up some discussion too, I imagine. So what 6 is on, because I've had a tremendous amount of communication from both House and Senate members about, there's a little bit of lack of understanding of what exactly has happened. We've had a speech and some pronouncements of some mandates, but really, and we know, I think there's consensus, at least among the majority of this body, that something needs to be done, but what that is might be, up in the air about what that is. So I think this is just an open point of discussion on one, and I might even have Gordon, it's my understanding, there were 3 general pronouncements, and please help me if I'm wrong. One dealt with just federal employees, and we probably have nothing that we can contribute to there. The second one, probably more relevant, is we're anticipating they're going to utilize some type of rules promulgated from OSHA to affect any, even private employer with 100 or more employees, Kansas employers. And that's something that probably needs a deep look. And then third, there was the people that deal with Medicaid, Medicare, that type of, any institution that does that, which is already affecting, hospitals, long-term care facilities. There could be a real issue there, and how that affects, staff shortages inside our institution. So this is meant to be a little bit of a discussion just for the edification and understanding of this committee. What exactly are we looking at? And because I think I heard the Attorney General, I think his comment resonated with me. He said, I can't sue a speech. So I'm trying to figure, I agree with that. So what is it, as we're waiting for these rules to promulgate, And I'm not sure exactly what posture we're in, other than the clarity that we need to do something to protect Kansans. So I'm open for discussion on that. Is there discussion? Speaker Reichman.
Thank you, Mr. President. You know, I think the majority of this body was recognized it was definitely an overreach of President Biden and his mandates. And so then it comes down to what can we do? And I think I agree with what your words were, to echo what the Attorney General said, is you can't sow a speech. And so one of the things we have done is we did write a letter to our president expressing our unsatisfaction actions or disapproval of his actions. I had, I think, 75 House members and 28 senators sign on that letter. In addition, we've asked our federal delegation, what are they doing? What can we do? What can we do together? We've heard from one of the 6 that we sent it to so far. We also can speculate. Some of our members have asked things they could possibly do, and one of the things that comes up is that the state could pass a law that says that the Kansas businesses do not have to answer to OSHA fines when they come to COVID. So we asked the research department, what can that potentially cost the state of Kansas? Because the fines are still going to come. If you remember, we did the same sort of thing invoking the 10th Amendment with some of our fire alarm laws. And the feds still came in, and now we have 2 folks with felonies on their records because of it. So we need to learn from that and be cautious as we move forward. So if we were to come back and pass a law that said that Kansans do not have to listen to OSHA when it comes to COVID regulations, there are about over 3,800 firms with over 100 employees. The first fine is $13,000 a day, $13,653. The next day it goes to $136,000 a day. So if every one of our companies in Kansas, over 100, decided that they did not want to abide by this regulation because we passed that in the state of Kansas that they didn't have to, that could be a $528 million bill a day. Maybe 10% decide that they're not going to follow, and the state's going to pick up that tab. That's $500,000 a day. The other thing you talked about is, you know, with Medicare and Medicaid, and the way the speech has been written and the guidance so far has been sent out, that if our companies do not follow the law from our president or our executive order, they can lose their federal money. And that's about $4.1 billion a year. And so we are looking for solutions that do not cost $500 million a day or $4.1 billion a year. And hopefully, and again, it's all hands on deck. It's checking with other states, it's checking with our federal delegation. But we want to find real solutions to these problems before we start doing things that could be reckless. And why I'm on the mic here, I want to be clear that I believe folks should be vaccinated. I just don't believe they should be told or mandated to.
For discussion, Senator Sykes.
Thank you. I agree we do need to have solutions, and unfortunately, this whole pandemic has become very political, and where we are setting aside health experts and all of that. Yes, I agree there should not be a mandate, but it's not really a mandate when there's another option. It says get a vaccine or have regular testing. And I think we have to get behind that. We need to mitigate the spread of this so that we can get back to being able to gather together. And when we are up here debating and saying, yes, I support vaccinations, but everyone gets the right and we don't need to be telling people what to do. We don't need to be telling people what to do, but we need to be leaders and showing that, yes, you can take a responsible decision of getting a vaccine or having regular tests to make sure that you're keeping those around you safe. I've been talking to my hospitals. You know, I know it's different in other parts of the state, but we are losing nurses because people are not getting vaccinated and they don't feel safe. Their children are not able to have a vaccine yet, and they are going to work and they're putting the rest of their family in danger. So yes, we do need solutions, but part of that solution is looking at what is right for society. And my freedom does not mean I don't have to look out for my neighbor as well. And so I think this is a good policy. Let's get vaccinated, but if you don't want to get vaccinated, can you at least have the common courtesy to get tested regularly? And we have Fox News, I believe every day their employees have to be tested. So we can step up and be leaders and get us out of this so that we can get back to our day-to-day and make sure our economy is thriving.
So that actually brings me to a couple comments. And one is right in line with what we don't know. The statement was made that this has been what's directed, you vax or take a test. We don't even know what that is, right? We don't even, what does or take a test mean? Because we don't have any rules promulgated. We don't have anything to go. But on that note, and my daughter is an RN that works gap fill in a COVID hospital. She can't name me one person that's going to quit their job because they're not mandating vaccines, but she can name you 10 off the top of her head in the inverse. Because we have, and then now put that into the long-term care facility conversation. And so we need to understand, because it could be in very dire straits if you force something down the throat of Kansans. We are in a posture where everybody, if not almost everybody, that is 100% with the vaccines or even ambivalent to vaccines that are vaccinated. We are encroaching now on a population that has, for whatever reason, whether you agree with them or not, might have a personal or religious reason for not, or just a general health reason, and being recommended by their physician to not. And now we're trying to pinch in on that population, and we're going to create tremendous amounts of anger and this ridiculous notion that with the science, somehow it's vax or unvax or vax or test. There's many studies that show even vaccinated people and get vaccinated. I mean, I'm okay with that, but there are vaccinated people that get and shed the virus. That person can infect, a vaccinated person can infect another person. So they should also be tested, right? Because the goal is to get healthy frontline workers manning beds. We heard from our major hospital provider in Wichita, they're at 50% of their licensed bed. So they're full at 50% due to staffing. That's been the rub. We need healthy nurses manning beds, frontline respiratory therapists, you name it. We need frontline workers. We need them in our long-term care homes. We need them in our hospitals. So this say vax or test just amplifies this unnecessary battle. It's like we're creating this stance that there's the vaccinated and then there's the unwashed masses. There are a whole lot of people for a whole lot of really good reasons that may make this choice. And that's where we're at. And that's what the fear is. And that is real fear by real people. And that's why we are having this discussion, because we need to understand what it is we can do to protect Kansans, our Kansans that are vaccinated, or Kansans that are unvaccinated, or Kansans that are elderly, or Kansans that are hospitals. That's what we need to understand. And this idea of a dictatorial edict going clear down into our private companies is something we will have to address at some point. So that's the point of discussion. I think really for the purposes of this meeting, and I'll continue discussion with you. I'll let you have a last word. Well, maybe last word. I'll let you have a word. But is basically direction to our revisor's office to dig into, because we need coordination. We need coordination with our federal delegation. We need coordination with our attorney general, with whatever the legislature does. And it really even in consideration of what I'm sure will be a host of private lawsuits as it pertains to the subject matter. We need coordination to make sure we're not flying off the handle with something that we can't sustain or has an unintended consequence. So this would be direction to our revisor's office to really report back to us what we think those legal options may or may not be once rules are propagated. and to our research department. Right there, anything that they can do to help with that conversation. I'm not even sure what that is. So I think it's not necessarily an action of this body today, other than direction of our legislative staff to have that all in mind. So with that, Senator Sykes.
I will say there are federal recommendations and statutes that protect because of a religious or an adverse reaction. And I actually agree with you. Yes, I think everyone should be testing. I've had allergies, but out of abundance of caution for those around me, I've also been tested to make sure I'm not, even though I'm vaccinated, that I'm not shedding the virus to someone else. But I think this actually opens up, it's a bigger question about healthcare in the U.S. and having access and people having to go to work because they're working, day in and day out trying to make a living, and they can sometimes take time off of work because they're sick, and other times if they're not there, they're going to lose that job, which I know I could go into Medicaid expansion, which I won't, but I think it is a larger conversation about how do we provide solutions for Kansans and actually all Americans.
Speaker Reichman.
Thank you, Mr. President. Some of the things we've talked about, I know our revisor, Mr. Self, has been working on some. And again, we did send a letter to our federal delegation to see what they can do about it, what other states are doing, even what other states are doing with Republican governors. And then, of course, what can we be doing? And so it's a all hands on deck approach. I know there's a lot of people, a lot of frustration, but we need to have a plan. We need to know what we actually can do that's actually going to move the needle and help protect our citizens. So I don't know if Gordon wants to provide an update what they have done. Again, it's your call, Mr. President. But again, even before we get the next report or next meeting, maybe let people know what research has been done to this point.
Gordon, since we're talking about you a lot, you care to make comment?
Yes, thank you, Mr. Chairman. Our office has been requested to look into the issues that are around the mandate, and what we've done so far is, as is in this discussion, it's hard to analyze because the implementation rules and guidelines have not been issued, and so not only does that make it, as the Attorney General indicated, not ripe for consideration of filing a lawsuit. We're also part of our as looking into options and stuff will be dependent on what the rules and guidelines actually say. But in the meantime, we are in communication with the Attorney General's office, who is analyzing from their perspective, because it's a federal issue. The first vantage point you look at is a federal approach to it, both from a congressional standpoint, but also from a filing of a lawsuit. And then from a state standpoint, it gets more complicated because we're looking at an interaction between federal and state law. And then finally, I'll add to you, both the chair and vice chair, the money, the appropriations aspects of this are very critical as well. And so we are looking into what other states are doing from the standpoint. We've heard rumors about action that states are planning, but we're trying to tie down exactly, what the specifics are. And so, whether it's from a statutory basis approach or whether it's, as Mr. Speaker indicated, having to do with the actual appropriations, we're looking at, a lot of states are making statements, but they're not specific yet about what they might do. And so we're looking into that. And as we try to provide information for you, we also want to provide some options are more viable than others. Some options are more appropriate and doable than others. And I'm also aware that, we're not in session right now. And so that makes it more difficult for you in terms of what your options are. It's very difficult to deal with these things when we're not in session.
So I think our request would really probably a report from you at our next LCC meeting about what you've kind of determine maybe what other states have done or attempted or what options they've taken and what you think might be a few options for us as we take that on, and we'll just look for reports. So with that, I've reached the end of my agenda, and we are adjourned.